Welcome back to my channel, The Life in the Womb. Please do subscribe to this channel so that I will feel motivated to do more and more videos in future. In this session, I would like to talk about the arterial supply of cerebrum. So we know that there are mainly two systems of vessels supplying the cerebrum. One is the basilar system, which is formed by the union of two vertebral arteries, and the other one is internal carotid system. So these are the two major vessels supplying the cerebrum as a whole. Now, before moving on to the branches arising from the cerebral arteries, we would like to know more about the pattern of branches arising from these vessels. So there are mainly three patterns of vessels which are arising from the arteries arising from the vertebral system as well as the internal carotid system. They are named 1. the cortical branches, 2. the central branches, and the third type is known as the choroidal branches. So these are the pattern of branches. These are not the name of the branches. These are the pattern of branches arising from the vessels, the major vessels like the basilar system as well as the internal carotid system. So what do you mean by the cortical branches? The cortical branches means the vessels supplying the cerebrum will be actually forming a network over the pia mater. So when they form a network over the pia mater, so imagine this is the pia mater. So over the pia mater, the vessels which are meant to supply the cerebrum will be forming a network, an anastomotic network. And from this anastomotic network, there will be two sets of arteries arising. One is short and the other one is long. So you will get two types of arteries arising from this network of anastomosis which is seen over the pia mater. One is known as short cortical branches and the other one is known as long cortical branches. Why are they named short and long? Short means they won't come into the inner aspect of the cerebrum. That is, they will be confined to the outer aspect of the cerebral cortex. Since that is the reason why they are known as short cerebral arteries or short cortical branches. So even though we mentioned that there is a network of anastomosis, once these short and long cortical branches arise, they are known as end arteries. Once they arise from the network of anastomosis, they are known as end arteries. That is, further there is no anastomosis between them. So short cortical branches means they are confined to the outer cerebral cortex. So what do you mean by long cortical branches? Long cortical branches will travel further and they will be supplying the outer aspect of the white matter of the cerebrum. So these are the two pattern of vessels. They are known as cortical branches. So the cerebral vessels which are meant to supply the cerebrum as a whole will be forming a network of anastomosis and they will be overlying the pia mater, and from the pia mater the end arteries will be arising. One set is known as short arteries since they are short and they will be supplying only the outer cerebral cortex, whereas the other set is known as long cortical branches because they will be traveling further away until it supplies the outer aspect of the white matter of the cerebrum. So that is one pattern of branches. Now the next pattern of branches, you call it as central branches. What do you mean by central branches? Central branches means, if you imagine this as the cerebrum, the cerebral hemispheres, there are some structures seated at the base or on the inferior aspect of the cerebrum, like the internal capsule, the caudate nucleus. So some structures like that will be there in the innermost aspect of the cerebral cortex towards the base. So there is a system of vessels known as circle of Willis. So if you imagine this as a cerebrum, at the base of the cerebrum you will get a circle of Willis. That is actually a anastomotic network formed between the vertebral system as well as the internal carotid system. So the branches arising from the circle of Willis, you call it as central branches. So they are mainly the branches arising from the circle of Willis meant to supply the inferior aspect of the cerebrum and also the innermost aspect of the inferior surface of cerebrum. So the details of the central branches we will come to it later once we discuss about the circle of Willis. The third component you call it as choroidal branches. So again, what do you mean by choroidal branches? You all know that the CSF, the cerebrospinal fluid, is produced by the choroid plexus. So you have the choroid plexus in the ventricles. So there are mainly two types of choroidal vessels. One is known as the anterior choroidal and the other one is known as the posterior choroidal. Anterior choroidal as well as posterior choroidal. So where are these vessels coming from? The anterior choroidal is actually arising from the internal carotid artery and the posterior choroidal is actually arising from the posterior cerebral artery. And where will you see these choroidal vessels? Anterior choroidal vessels will be actually invaginating through the pia mater and it will be seen in the inferior horn of the lateral ventricle and they will be forming a choroid plexus in the inferior horn of lateral ventricle along with the ependymal lining of the lateral ventricle. And what about the posterior choroidal vessels? Posterior choroidal vessels, we have already mentioned that it is arising from the posterior cerebral artery and they will be forming the choroid plexus in the third ventricle as well as the lateral ventricle. So that is what is meant by the choroidal vessels. So these are the different pattern of branches arising from the cerebral vessels. Now we will come to the details of circle of Willis. So what do you mean by circle of Willis? Circle of Willis is otherwise known as circulus arteriosus, circulus arteriosus or circle of Willis, circle of Willis. So we mentioned that there are three types of branches, cortical, central and choroidal, out of which the central branches are actually arising from the circle of Willis. So let's see how the circle of Willis is formed. This artery, these are the two vertebral arteries, right and left vertebral arteries, and they will ascend along the ventral aspect of the brainstem, and when they reach the inferior border of pons, this is pons, when they reach the inferior border of pons, they will join together to form a single artery known as basilar artery. And the basilar artery will be lying in the basilar groove in the pons, and the basilar artery will be further dividing, that is, it is terminating by dividing into two major arteries supplying the cerebrum. This is known as the posterior cerebral artery. So you have two vertebral arteries joining at the inferior border of pons to form the basilar artery, which is terminating by dividing into two posterior cerebral arteries. Now we have another set of vessels, that is, this is the internal carotid artery. So internal carotid artery actually gives rise to two main branches, that is the anterior cerebral. Anterior cerebral artery is actually a very small branch compared to the major branch, that is the middle cerebral artery. So this is actually the cut end of the internal carotid artery. From this you can see this is a larger branch, this is the middle cerebral artery. So this is the middle cerebral artery and a very fine branch arising from this is known as the anterior cerebral artery. So on either side you can see the anterior cerebral artery as well as the middle cerebral artery. So this is actually the cut end of the internal carotid artery. So we now know that the cerebrum is actually supplied by three major arteries: anterior cerebral artery, middle cerebral artery. These are two branches arising from the internal carotid artery, that is, they belong to the carotid system. And the other one is posterior cerebral artery, which is actually the terminating branch of the basilar artery. So they belong to the vertebral system. So but even though we mentioned that there are three cerebral arteries, when we discuss about the circle of Willis, only two vessels, that is the posterior cerebral artery and the anterior cerebral artery, are forming or participating in the anastomotic network of circle of Willis. That is, the middle cerebral artery is actually out of the circle of Willis. Now let's see the anastomosis. So when they anastomose, they will be actually forming a six-sided polygon. They will be forming actually a six-sided polygon. So how are they forming the six-sided polygon? When we discuss that it is forming a six-sided polygon, first we should know in which plane the circle of Willis is lying. So whenever we discuss about the cerebral blood vessels, they are lying in the subarachnoid space. Subarachnoid space means we know that the brain is covered by meninges. The three layers of meninges are the outermost you call it as dura mater, then you call it as pia mater, and the innermost you call it as arachnoid mater. So the dura, arachnoid and pia. So these are the three coverings: outermost dura, middle arachnoid and innermost pia. So just below the arachnoid you call it as subarachnoid space. So it is in the subarachnoid space you have the major vessels going to supply the cerebrum. So in the inferior aspect of cerebrum there is a space known as interpeduncula cistern. Interpeduncula cistern means you can see this is the pons, and above that you have the midbrain. So there are two cerebral peduncles on either side. So the space lying between these two cerebral peduncles, this area is known as interpeduncula space. So the subarachnoid space in this interpeduncula space will be actually harboring the circle of Willis. So let's see how the circle of Willis is formed. In the posterior aspect, you have the posterior cerebral artery, that is the two vertebral arteries joined together to form basilar artery, which further divide to form the posterior cerebral arteries. And in the anterior aspect, you have the internal carotid artery, which is giving rise to the anterior cerebral artery, and the two anterior cerebral arteries are connected by anterior communicating arteries. Anterior communicating arteries. So we have two systems. Now these two systems should be connected. So what is the connecting element? You can see one artery coming from the internal carotid artery and joining with the posterior cerebral artery on either side. This branch is known as posterior communicating artery. Posterior communicating artery. So let's see what are the arteries eventually forming the circle of Willis. Posteriorly you have the basilar artery dividing into posterior cerebral artery. Anteriorly you have the anterior cerebral artery connected by the anterior communicating artery, and these two systems are connected by posterior communicating artery arising from the internal carotid artery. So that a circle is formed. That is known as circle of Willis. Now let's discuss about the branches arising from the circle of Willis. We already mentioned that the central branches are the type of branches arising from the circle of Willis. So what are the central branches? So central branches, they are actually two sets. The set seen anteriorly and the set seen posteriorly. So what do you call the anterior set? Anterior set, actually there are some branches arising towards the medial aspect. Can you see the medial, towards the medial aspect? This is known as anterior perforating branches. So you can see the branches coming from the anterior cerebral artery as well as the anterior communicating artery. So they are known as anterior since they are perforating the anterior perforated substance, they are also known as anterior perforating branches or anteromedial branches. Anteromedial branches. So we can see that this is arising from the anterior cerebral as well as anterior communicating artery, and it is seen towards the medial aspect. And what are the structures supplied by the anteromedial branches? They supply the anterior limb of internal capsule as well as corpus striatum. Now we can see another set arising from the middle cerebral artery towards the lateral aspect in the anterior part. They are known as anterolateral branches. Anterolateral branches. So these anterolateral branches are again perforating the anterior perforated substance, and these will be supplying the anterior limb of internal capsule, caudate nucleus as well as lentiform nucleus. And one of the branches, so the anterolateral branches are also known as lateral striate arteries. Lateral striate arteries. So the one of the lateral striate artery is known as Charcot's artery. Charcot's artery is a branch arising from the lateral striate arteries or the anterolateral group. So Charcot's artery is famous for cerebral hemorrhage. So this is known as the artery of cerebral hemorrhage. Now let's move on to the posterior group of central branches. So similar to the anterior group, you have posterior group in the medial aspect as well as in the lateral aspect. So in the medial aspect, you call it as posteromedial branches. So posteromedial branches will be arising from the posterior cerebral artery as well as the posterior communicating artery, and they will be piercing the posterior perforated substance. So the posterior posteromedial group will be supplying the thalamus, subthalamus and hypothalamus. Now another set arising from the posterior cerebral artery towards the lateral aspect. This is known as posterolateral group. Posterolateral group, and they will be supplying thalamus and the geniculate bodies. So these are the branches arising from the circle of Willis, and they belong to the group known as central group of branches. So anteromedial, anterolateral, posteromedial and posterolateral. So ultimately these branches are supplying the internal capsule, the caudate nucleus, the lentiform nucleus, the thalamus, hypothalamus, subthalamus and the geniculate bodies altogether. Now the importance of the circle of Willis is sometimes there are berry aneurysms or congenital aneurysms. This is actually due to a defect in the formation of tunica media of these vessels. So there are no sufficient number of elastic fibers. So ultimately there will be dilatation of that segment, which will result in berry aneurysm. So these berry aneurysms are usually seen at the junction or the meeting point of these vessels. So the meeting point of the vessels, you will get a dilatation. That is the commonest site, they say. So they are known as berry aneurysm. So what is the importance of berry aneurysm? Berry aneurysm are usually asymptomatic, but it will be symptomatic when they rupture. So when they rupture, there will be bleeding into the subarachnoid space, and the patient will be presenting with severe headache and usually followed by death. Even if at all the patient survives, he'll be dying 2 or 3 days later. So that is the severity of rupture of berry aneurysm. So usually the berry aneurysms are congenital aneurysms and usually asymptomatic, but if they are symptomatic, you won't get time to deal with the situation. So that is about the circle of Willis. Now as a total, let's see how the cerebrum is supplied by the 3 major vessels, that is the anterior cerebral, middle cerebral and posterior cerebral. Anterior and middle comes from the internal carotid and posterior cerebral comes from the vertebral system, that is they are the terminal branches of basilar artery. So when we discuss about the cerebrum as a whole, there are 3 surfaces, that is superolateral surface, this is a medial surface and this one is the inferior surface. And you have to note one point, all the 3 surfaces are supplied by all the 3 arteries, that is the anterior cerebral, middle and posterior cerebral are supplying all the 3 surfaces, but one will be predominating in all the 3 surfaces. So let's see. In the superolateral surface, the middle cerebral artery will be predominating, that is the 2/3 of the superolateral surface will be supplied by middle cerebral artery. Likewise, the medial surface, the 2/3 of the medial surface will be actually supplied by the anterior cerebral artery, and the 2/3 of the inferior surface will be supplied by the posterior cerebral artery. That is the sequence of distribution. One artery, though we say that all the 3 arteries are supplying the cerebrum, one artery will be predominating. So superolateral surface, the predominant artery is middle cerebral. Over the medial surface, it is the anterior cerebral, and over the inferior surface, it is the posterior cerebral artery. So let's have a look at the superolateral surface. Superolateral surface, you can see this area is actually supplied by middle cerebral artery. I'll be dealing with the functional areas of cerebrum in future. So for the time being, let's see the important functional areas coming in the area of supply of middle cerebral artery. You can see the central sulcus and pre and post central gyrus. So that means the motor and sensory area, the main motor and sensory areas lie in this region. And you can also get the Broca's and Wernicke speech area and the auditory areas. So these are the major areas coming in the region of supply of middle cerebral artery. What about the anterior cerebral artery on the superolateral surface? This is actually supplying a thin rim towards the supromedial border, and they will be supplying some region of the frontal lobe as well as the parietal lobe. What about the posterior cerebral artery? Posterior cerebral artery is actually mainly supplying the occipital cortex, that is the visual cortex is mainly supplied by the posterior cerebral artery. That is about the superolateral surface. What about the medial surface? Medial surface, it is actually 2/3 is supplied by the anterior cerebral artery. So let's have a look about the major area supplied by the anterior cerebral artery here. This region over the medial surface is known as paracentral lobule. Paracentral lobule. So that area is actually concerned with the defecation and micturition reflex. So that area and some of the frontal lobe is actually supplied. These are the main functional areas supplied by the anterior cerebral artery. And coming to the middle cerebral artery, this is known as the temporal pole. So this temporal pole is supplied by the middle cerebral artery, and again the visual area, occipital lobe, is actually supplied by the posterior cerebral artery. So ultimately the posterior cerebral artery is concerned with the visual cortex. That is how we look onto the medial surface. Now if you look onto the inferior surface, again the 2/3 is supplied, the posterior aspect, the 2/3 is supplied by the posterior cerebral artery. The temporal pole is actually supplied by the middle cerebral artery, and also the lateral aspect of the orbital region of the frontal lobe. So this region again is supplied by the middle cerebral artery. So the anterior medial aspect is supplied by the anterior cerebral artery. So this is the distribution of these cerebral arteries over the inferior surface. That is 2/3 by the posterior cerebral artery. Then the temporal pole and the lateral aspect of the orbital part of the frontal lobe is supplied by the middle cerebral artery, and a narrow strip towards the anterior aspect is supplied by the anterior cerebral artery. So just let's have a quick revision of the arterial occlusion. What will happen if anterior cerebral artery is occluded? Let's see the pattern of distribution of the anterior cerebral artery. We have mentioned two important regions. One is the paracentral lobule and the other one is the frontal lobe. So these are the two important functional areas. Of course, you are getting some strip of the motor and sensory areas, but these are the functional areas with which the patient will be presenting. The complaints will be pertaining to these regions. So the patient will be having micturition defecation issues as well as the personality disorders since the frontal lobe is affected. What will happen if the middle cerebral artery is occluded? Middle cerebral artery, we said that it is mainly supplying the chief motor and sensory area. So if this chief motor and sensory area is affected, the opposite side, the contralateral hemiplegia, that will be the presenting complaint of patient if this middle cerebral artery region is affected. Apart from that, the patient will also be having speech disorders if the dominant hemisphere is affected. The middle cerebral artery supplying the dominant hemisphere is affected, you will get the speech areas, the motor and sensory speech areas in that hemisphere. So speech also will be affected, and there will be auditory, the hearing loss, though it won't be prominent, still the patient will also have some sort of auditory hearing loss. So these are the regions supplied by the middle cerebral artery. And what will happen if the posterior cerebral artery is affected? Posterior cerebral artery, wherever it is mainly supplying the visual cortex. So when this posterior cerebral artery is occluded, the patient will be presenting with contralateral homonymous hemianopia. That is a clinical condition, contralateral homonymous hemianopia. Again, I'm planning to do a detailed session about the visual pathway. Then I will be discussing about what do you mean by the contralateral homonymous hemianopia. For the time being, you just remember that the posterior cerebral artery is supplying the visual cortex, and if it is occluded, the patient will be suffering from contralateral homonymous hemianopia. But one thing I would like to mention is, even though the posterior cerebral artery is occluded, this region, the occipital pole, which is actually concerned with the macular vision, this region will be spared if only the posterior cerebral artery is occluded, because there is a collateral circulation. There are collaterals coming from the middle cerebral artery and supplying the occipital pole, which is concerned with the macular vision. So even if the posterior cerebral artery is occluded, there is macular sparing. So these are the applied aspects of the important cerebral vessels. So to conclude, the cerebrum as a whole, I haven't dealt anything about regarding the cerebellum, the brainstem and all. I'm planning to do it, but for the time being, when you think about the cerebrum, there are mainly three major vessels: anterior cerebral, middle cerebral and posterior cerebral vessels, out of which anterior and middle arise from the carotid system and posterior cerebral arises from the vertebral system. And there are three patterns of vessels arising. One is cortical branches, central branches and choroidal branches, out of which the central branches are actually the branches of the circle of Willis, and circle of Willis is actually seen at the inferior aspect of the cerebrum in order to supply the internal capsule, the corpus striatum, the thalamus, subthalamus, hypothalamus, the geniculate body. So all the structures situated on the inferior aspect of cerebrum are supplied through the central branches arising from the circle of Willis, and we have discussed about the clinical conditions as well. Hope you like this session. Please leave a comment regarding the topics which I will be dealing in future, if you would like to hear from me, so that I will be doing those topics in future. Please do subscribe. Thank you.